Greetings. I wanted to put together a presentation on the Arkansas Massage Therapy Apprenticeship Programs. There is a lot of misinformation going on regarding the apprenticeship programs for massage therapy in Arkansas, so I thought this would be helpful. HB 1875 and background. On April 6, 2021, Arkansas House of Representatives introduced a bill, HB 1875, and on April 21st, 2021, the bill was signed into law, becoming Act 811, an act to create the Earn and Learn Act, to allow individuals to work and earn a paycheck while also fulfilling licensing requirements and gaining the skills to fill the needs of an expanding workforce and for other purposes. The bill amends Arkansas Code Title 17 to add an additional chapter, Chapter 4, the Earn and Learn Act. The act became effective on January 1st, 2022. The act also refers to Title 29 CFR, Part 29. This is the U.S. Code of Federal Regulations, Title 29 specifically being labor, Part 29 specifically being labor standards for the registration of apprenticeship programs. To quote the bill and act, the General Assembly finds that apprenticeships prioritize on-the-job training and provide workers the opportunity to earn a paycheck while working towards industry-recognized credentials. Apprenticeships allow employers to build a skilled workforce according to industry standards, and occupational licensing prevents the citizens of this state from taking full advantage of apprenticeships because many apprenticeship-friendly jobs require a license to legally work in this state. It is the purpose of this chapter to allow individuals to work and earn a paycheck while also fulfilling licensing requirements and gaining the skills to fill the needs of an expanding workforce. To quote Act 11, definitions as used in this chapter. Apprenticeship means a program that meets the federal guidelines set out in Title 29 Code of Federal Regulations, Part 29, as existing on March 1st, 2021. And existing programs currently implementing work requirements as approved by the United States Office of Apprenticeship as meeting the requirements of an apprenticeship. License means a license, certificate, registration, permit, or other form of authorization required by law or rule that is required for an individual to engage in a particular occupation or profession. And licensing entity means an office, board, commission, department, council, bureau, or other agency of state government having authority to license, certify, register, permit, or otherwise authorize an individual to engage in a particular occupation or profession. Continued. Treatment of apprenticeships regarding licenses. A licensing entity shall grant a license to an applicant who completes an apprenticeship in the licensed occupation or profession, passes an examination if deemed to be necessary by the licensing entity, pays any fees deemed necessary by the licensing entity, does not have a disqualifying criminal record as determined by the licensing entity under state law, and completes all other requirements for licensure unrelated to training and education. If a licensing entity denies a license to an applicant under this chapter, the licensing entity shall provide the applicant with a denial in writing and explain the reason for the denial in the written decision, such as whether the licensing entity determined that the applicant's apprenticeship program does not correspond to the profession or occupation or level of license for which the applicant applied. A licensing entity shall establish a passing score for examinations that does not exceed the passing score required under the standard licensing processes. If the licensing entity does not require an examination for the standard licensing process for a profession or occupation, an applicant who completes an apprenticeship for the profession or occupation is not required to pass an examination. A licensing entity shall establish a licensing fee that does not exceed the licensing fee required under the standard licensing processes. If the licensing entity does not require a fee for the standard licensing process for a profession or occupation, an applicant who completes an apprenticeship in the profession or occupation is not required to pay a fee. Except as otherwise required by federal law, an apprenticeship for a profession or occupation is not required to exceed the number of hours required by the licensing entity for the profession or occupation. Construction. This chapter does not apply to a licensing entity that does not license individual workers for which there is an apprenticeship program established under Title 29, Code of Federal Regulations, Part 3229, as existing on March 21st, 2021. A license that requires the educational equivalent of a bachelor's degree or higher, or a license issued by the State Board of Barber Examiners or the Department of Health regarding cosmetology. Do not codify rules. All licensing entities, as required under this Act, shall promulgate rules necessary to implement this Act. When adopting the initial rules to implement this Act, the final rules shall be filed with the Secretary of State for adoption on or before January 1st, 2022, or if approval under has not occurred by January 1st, 2022, as soon as practical after approval under, a licensing entity shall file the proposed rule with the Legislative Council under sufficiently in advance of January 1st, 2022, so the Legislative Council may consider the rule for approval before January 1st, 2022. An overview of the apprenticeships. Occupational title is a certified massage therapist. Apprenticeship approach is competency-based. Term of apprenticeship, the term is 1 year with on-the-job learning, sometimes shortened to AJL, an attainment of 2,000 hours, completing 6 core competencies, and supplemented by the 500 minimum required hours of course curriculum-related instruction. The apprentice to journey worker ratio is 3:1, 3 apprentices to 1 journey worker on the work site. Apprentices shall be paid a progressively increasing schedule of wages based on either a percentage or dollar amount of the currently hourly journey worker's wage rate. After 4 months and completing 2 competencies per hour, after 8 months and completing 4 competencies per hour, after 12 months and completing all 6 competencies per hour. Every applicant selected for apprenticeship will serve a probationary period of 2 months. Apprenticeship selection. Selection procedures. The sponsor shall accept all application and determine those that meet basic qualifications to proceed through the selection process. Applicants that meet basic qualifications will be referred to participating employers for interviewing, accepting, and hiring for admission into the program. The selection procedures will be uniformly and consistently applied to all applicants and apprentices, and will not use any discriminatory selection procedures at any time. The employer will select the applicants based on their interview. The participating employer will provide employment verification, and the apprenticeship program manager will enter apprenticeship data into Rapid's database. The selection procedure will be uniformly and consistently applied to all applicants and apprentices, and will not use any discriminatory selection procedures at any time. The work progress schedule. This is the 2,000 hours of on-the-job learning, OJL. There are 6 core competencies in this. The 6 competencies being plan and organize an effective massage and bodywork session, perform massage therapy and bodywork for therapeutic benefit, develop and implement a self-care strategy, develop successful and ethical therapeutic relationships with clients, develop a strategy for a successful practice, business, or employment situation, and identify strategies for professional development. Competency checklist. Each competency and element of the competency will be graded and assessed with the following metrics. Training, meaning the mentor or journey worker has provided training and demonstration of a task to the apprentice. Demonstrates fundamentals. The apprentice can perform the task with some coaching. Proficient in task. The apprentice performs task properly and consistently. And finally, completion date. Date the apprentice completes final demonstration of their competency. Core Competency 1. Plan and organize an effective massage and bodywork session. Element 1.1. Organization and management of the client. which includes being able to communicate the plan and rationale for a treatment session to the client, obtain informed consent for the client prior to beginning a treatment session, modify the plan and therapeutic approach used during a treatment session based on client response, manage time within a treatment session, develop and implement strategies to address challenging client-therapist interaction. Element 1.2, confer with clients about their medical histories and problems with stress or pain to determine how massage will be most helpful, which includes utilizing therapeutic intake forms to gather necessary health history information in order to identify problem areas of the physical body, stress maintenance, pain issues, flexibility and mobility, and overall well-being. Identify and describe potential emotional effects of touch and specific massage or bodywork techniques as necessary. Identify specific indications, contraindications, and precautions to touch, massage, and bodywork, considering pathologies and various populations. And verbally communicate to the client a summary explanation of your plan for the massage therapy session and anticipated outcomes, and additionally answering any questions the client may have. Element 1.3, develop and propose client treatment plans that specify which types of massage are to be used. Develop a safe and effective initial session and ongoing treatment plan based on client goals, assessment findings, and understanding of effects of massage and bodywork. Write clear, concise, and accurate notes of client treatment sessions utilizing standard SOAP charting. Use healthcare and bodywork terminology to communicate treatment findings and therapeutic results. Element 1.4, treat clients in professional settings or travel to clients' offices and homes, which includes creating and maintaining a safe and comfortable professional office setting that is compliant with local municipal standards and licensing or permitting requirements, maintaining all necessary professional licensing and professional liability insurance to ensure the safety of the public, utilizing standard professional equipment in the professional office setting, or for the purpose of travel to client offices and/or homes, and keep up to date all necessary continuing education requirements as set forth by the governing state, municipality, or licensing agency of jurisdiction. Element 1.5, equipment and supplies, includes demonstrating safe and effective use of equipment such as massage tables, massage chairs, and bolsters, and supplies such as linens, lubricants, and gloves. Element 1.6, maintain treatment records, which includes accurately maintaining all documentation and treatment records for each client in a secure, organized, and accessible manner, and ensuring that client records are maintained with privacy requirements of HIPAA and allow efficient access to copies of the treatment records at the request of the client. Core Competency 2, perform massage therapy and bodywork for therapeutic benefit. Element 2.1, application of techniques, which includes demonstrating techniques that are within the scope of training and practice of commonly recognized massage therapy or bodywork disciplines. Identify and apply principles and protocols for massage and bodywork sessions. Vary the choice and application of techniques as appropriate to the client's needs, including those of special populations. Demonstrate techniques that are appropriate for each body area, including endangerment sites. Identify and practice appropriate methods of sanitation and personal hygiene in the performance of massage and bodywork sessions. And describe and demonstrate standard precautions. Element 2.2, apply finger and hand pressure to specific points of the body, which includes administering manual therapy techniques that effectively produce the desired results for change in the soft tissue, improve postural and joint alignment, enhance body system function, and improve the comfort other specific points of the body. And utilize stretching techniques when appropriate to greater facilitate the effectiveness of the manual therapy techniques applied. Element 2.3, massage and knead muscles and soft tissue of the body to provide treatment for medical conditions, injuries, or wellness maintenance, which includes identifying soft tissue structures of the body to apply massage, therapy techniques in order to facilitate improvement for any conditions, injuries, or health and wellness goals, and applying various relevant massage therapy techniques to the individual client for all necessary systems of the body based on goals identified by the massage therapist and client for the purpose of the treatment session. Element 2.4, assess client's soft tissue condition, joint quality and function, muscle strength, and range of motion, which includes describing the purpose of assessment and data collection, performing assessment and data collection inclusive of history taking, observation, palpation, functional testing, and pain assessment related to the following areas: soft tissue structures of the body, joint mechanics, range of motion, and structural integrity of the joints, muscle strength, integrity of muscle tissue, and flexibility. And finally, palpating, functional testing, and pain assessment of the soft tissues, joints, and muscles of the body. And element 2.5, hydrotherapy, which includes describing various hot and cold hydrotherapy techniques, such as hot or cold packs, immersion baths, paraffin, ice massage, identifying the indications, contraindication, precautions, effects, and uses of hydrotherapy techniques, identifying the physiological principles and mechanisms involved in the effects of hydrotherapy, and describing appropriate methods of hygiene and sanitation for hydrotherapy applications. Core Competency 3, develop and implement a self-care strategy. Element 3.1, self-assessment and stress management, which includes assessing personal needs, behaviors, beliefs, attitudes, and knowledge relevant to the practice of massage therapy and bodywork, identifying how personal and cultural values, attitudes, and ethics influence professional values, attitudes, and ethics, identifying the physiological and psychological effects of stress, and identifying various stress reduction techniques and their benefits. Element 3.2, self-care and performance, includes identifying and describing the effects of physical fitness and lifestyle habits on the performance of massage and bodywork techniques, defining and describing the effects of centering, focusing, grounding, and breathing on the performance of massage and bodywork techniques, and identifying and demonstrating biomechanical skills necessary for the safe and effective performance of massage and bodywork techniques. Core Competency 4, develop successful and ethical therapeutic relationships with clients. Element 4.1, communication in the client-therapist relationship, includes defining and demonstrating active listening, rapport, empathy, and feedback, identifying strategies to effectively deal with emotional and behavioral client responses to massage therapy and bodywork treatment, and describing the principles of conflict resolution and apply conflict resolution skills effectively in the client-therapist relationship. Element 4.2, professional boundaries, includes identifying the qualities and characteristics of boundaries, identifying cultural differences related to boundary issues, defining and discussing the differences between a personal and professional relationship, discussing the importance of professional boundaries, defining and discussing transference and countertransference, describing techniques for establishing and maintaining safe and respectful boundaries with clients, discussing and demonstrating the use of draping during treatment as a professional boundary. Element 4.3, professional ethics, which includes identifying and describing the purpose of a code of ethics, identifying and describing the purpose of standards of practice specific to massage therapy and bodywork, identifying confidentiality principles related to massage therapy and bodywork practice, including requirements for HIPAA compliance, identifying common ethical situations in massage therapy and bodywork, and describing processes by which to effectively resolve ethical issues. Core Competency 5, develop a strategy for a successful practice, business, or employment situation. Element 5.1, basic business practices, which includes identifying common business practices and structures in massage therapy and bodywork practice, identifying and designing effective methods for time management, client scheduling, and maintenance of the work environment, creating a business plan or outline an employment strategy, including short and long-term professional goals, identifying the basic aspects of legal agreements, contracts, employment agreements, and professional insurance, identifying basic principles of accounting and bookkeeping suitable for various business structures, creating, maintaining, and identifying legal requirements for retaining client, financial, and tax records, demonstrating knowledge of federal, state, and local regulations as they pertain to massage therapy and bodywork practice, demonstrating knowledge of ADA requirements and their implication for massage therapy and bodywork practice. Element 5.2, job search and marketing, which includes identifying the elements of effective job search and marketing, materials such as resumes, brochures, and business cards, identifying and discussing common methods of marketing for massage therapy and bodywork, and identifying strategies to develop and maintain a client base. Element 5.3, professional referrals, which includes identifying strategies for effective communication with other professionals regarding client care and referrals, describing the process used to identify the scope of practice of allied health professionals, and describing the appropriate use of medical release and consent forms. Element 5.4, professional relationships, which includes discussing the process for establishing and maintaining professional relationships in the workplace, discussing strategies for establishing and maintaining professional relationships with peers and with other professionals, and identifying strategies for conflict resolution with other professionals, including the need for documentation. Core Competency 6, identifying strategies for professional development. Element 6.1, history of the profession, which includes describing the history of massage therapy and bodywork, identifying the role of professional associations for massage therapists and bodyworkers. Element 6.2, ongoing education, which includes discussing the value of ongoing education and skill development as a professional, and describing methods for identifying advancing training programs to enhance performance, knowledge, and skills. And finally, element 6.3, research literacy, which includes explaining the value of research to the profession, identifying sources of published research literature on therapeutic massage and bodywork, and critically read and evaluate a published research article in the field of massage therapy and bodywork. Related instruction outline. This is 500 hours. You will sometimes hear it referred to as job-related education or related instruction. Providers and methods. Methods include classroom, lab hours, online hours, and vendor demonstration. During the term of apprenticeship, each apprentice is required to complete approximately 500 hours of related education as it applies to the licensing requirements for massage therapists. Each apprentice's attendance and progress in related education must be tracked and appropriate records maintained. Courses may be taken during or outside the regular working hours. All time spent in such classes after regular working hours shall not be considered as work hours of work. If required to attend classes or work through online courses, the apprentices shall be compensated at the regularly hourly rate. Time devoted to the job-related education shall not be considered as part of the on-the-job learning, OJL, that we just discussed. And failure on the part of the apprentice to fulfill their obligation as to the related education and/or attendance, or their failure to maintain passing grades therein, shall constitute adequate cause for cancellation of their apprenticeship agreement. Related education course listings. The course listings outline the related education that supplements the on-the-job learning. It is through the combination of both the on-the-job learning and the related education that the apprentice can reach the skilled level of the occupation. The following is the required course curriculum during the term of apprenticeship. Science and Theory, 3 hours. Anatomy and Physiology, 125 hours. Pathology, 25 hours. Kinesiology, 25 hours. Theory and Techniques of Massage Therapy, 100 hour. Health, Hygiene, and Universal Precautions, 25 hours. The Business and Ethics of Massage Therapy, 25 hours. Labs and Clinicals, unspecified. Swedish Massage Techniques, 125 hours. Hydrotherapy, Electrotherapy, Heliotherapy, 25 hours. CPR and First Aid, 2 hours. Clinical or internship and different modalities, 50 hours. Current apprenticeship programs in Arkansas include the River Valley School of Massage in Russellville with Audra Finley, Massage Career Institute of Arkansas in Conway with contact Albert Pilkington, and Healing Therapy and Education located in Camden with contact Sybil Davis. Thank you.